Well, we know one of the populations at highest risk for COVID-19 is seniors in nursing homes.
Michigan has been putting long-term care patients recovering from the virus in the same facilities with patients who don't have the virus.
This is a policy New York Governor Andrew Cuomo just changed in his state because of the large number of deaths there. Local 4 business editor Rod Maloney is live tonight with more on the story. Rod.
Yeah, Kimberly, the state has announced today that we had 4,584 COVID-19 deaths so far. A sad number, tragic number. And I just found out about 10 minutes ago that the Department of Human Services is saying that 15% of that number came in Michigan nursing homes. But they're also saying, with the caveat, that it probably is more than that or could be more than that because they're not sure about the reporting of all of this coming from nursing homes. And so that has many people wondering about the wisdom of this particular policy. And one of them is State Representative Lisa Love from the city of Detroit.
And so to return seniors into an environment, seniors with the virus, still recovering from the virus, into an environment with well seniors just didn't seem like it's not a good idea.
And yet, this afternoon, the state's chief medical executive, Dr. Janae Khaldun, when asked about the practice, said,
"It's a good move. It was a good step to make these regional hubs. And I think as we move forward, we have to look at making sure we're really implementing best practices, looking at other best practices across the state as well."
Originally, the state wanted these patients to go to the TCF Center, but that didn't happen, and it closed the facility to much fanfare. Now, across the state of Michigan, 19 regional hubs are operating. This one, Evergreen Health and Rehab Center in Southfield, is one of 3 in Oakland County. Wayne County now has 8, including Regency at Shane and Advantage Living Center in Redford. This last one is near and dear to the heart of Democrat State Representative Lisa Love. Already trying to get answers about regional hubs, last week she found out her 86-year-old mother resides in one. Her mom's COVID negative. Love's worried about nursing home spread.
And that would break my heart. It would break my heart because I've been on the front line of this, trying to make sure that none of our seniors, my mother, your mother, anybody else's mother, does not get sick and die from this, particularly if they're in a nursing home.
And so she's asking more questions of the Department of Health and Human Services, wants more investigation into this. In the meantime, the state rules are very clear that they want these positive COVID patients in separate sections of nursing homes or completely separated from the people who do not have the virus. And they say that they're going to continue looking at that, making sure that these regional hubs are following that policy. Reporting live in West Bloomfield, Rod Maloney, Local 4.